I think there's a lot of take-home points. We got some important updates from ongoing trials, not just the luspatercept trial, but the MANIFEST study of a bromodomain inhibitor given in combination with ruxolitinib. We all have our eyes on that because of the huge improvements on response rates with respect to spleen volume reduction and symptom burden reduction as compared to single-agent ruxolitinib. I always take these kind of single-arm phase 2s with a grain of salt in terms of these, what you would consider a surrogate endpoint of symptom burden response and spleen volume reduction, and really waiting to see the phase 3 data. And of course, the MANIFEST phase 3 study is just launching now. The first center is on track to open the study by the end of the month. But it was good to see an update and good to see kind of a little bit longer follow-up from the predecessor study. Another drug that kind of emerged or reemerged during this ASH is Imetelstat. That's telomerase-directed therapy. It's kind of been off and on again for a while. And there was a reanalysis of the existing data in anticipation of an additional definitive phase 3 study launching soon. This analysis really showed that patients who had spleen volume reductions and symptom burden improvements had a better overall survival. And so, while those results are encouraging, I take that with a bit of caution as well, just because patients who do well tend to do well. So if you respond, of course, I would expect you to live longer. So it's a little bit tough to say how that will pan out in the phase 3 study, but everyone has their eye on this therapy coming forward. There was also another reanalysis of the momelotinib data. So momelotinib is currently under investigation in the Momentum study, which is pitting momelotinib, which is a JAK inhibitor, versus danazol for patients who are anemic as a result of their myelofibrosis and myelofibrosis treatments. This was a rehashing of the Simplify 1 and 2 databases, showing that, again, a significant number of patients had symptom improvement, a significant number of patients did have anemia responses there. Kind of, again, laying some more of the backstory for the ongoing phase 3 trial. So we saw a lot of that, a lot of reanalyses and data diving to bolster ongoing phase 3 studies. And so we're all anticipating at the next ASH or 2 getting those phase 3 results and really kind of seeing the completion of these stories. There was another presentation in the session that I chaired on a drug called PTG-300. And everyone has their eye on this drug as well. One is we need new therapies for polycythemia vera, no doubt about that. Hydroxyurea has been around for a very long time. We are awaiting Ropeg interferon here in the US. It's already approved in Europe. But outside that, there are not a lot of great agents for the treatment of polycythemia vera. And this PTG-300 is very exciting to hematologists in general because it uses hepcidin. You say hepcidin to a hematologist, they're going to swoon. It's just the fact of the matter there. So of course it's going to get everyone excited for that fact alone, but really the alleviation of phlebotomies in this group was quite impressive. There was a figure that was presented that showed on the left-hand side the number of phlebotomies these patients were getting, and it was just a bunch of red dots. And then they all started therapy in the middle of the slide, and on the right-hand side of the slide were the number of phlebotomies that occurred after initiated treatment. There were 3 dots. So it went from everybody getting tons of phlebotomies to control their hematocrit to almost no patients needing phlebotomies. It was pretty remarkable. I think we need more long-term safety data. Certainly we want to see more patients on this study to get a better wealth and treatment duration and durability and all these types of things. And it's going to take a long time. PV patients do really well for very long, just like ET patients. So we're going to need more patients and more time to see how this all pans out, but certainly an exciting agent.